You are drinking 8 glasses of water a day, exactly like your doctor told you, exactly like every article on the internet keeps saying. And you are not a gastroenterologist who has spent the last 2 decades working specifically with adults over 55. And what I see in my practice consistently is that most people that are over 60 who struggle with constipation are not drinking the wrong amount of water. They are drinking the wrong kind, at the wrong time, without understanding what is actually happening inside the intestinal wall. And that is the part most videos on this topic completely skip over. Because here is what the standard advice keeps missing. After 60, your gut does not just need water. It needs specific signals at specific moments to move properly. And when you get that wrong, and plain cold water, no matter how much of it you drink, can actively work against you. In this video, I am going to walk you through 3 things you can add to your water. 1 in the morning, 1 at midday, and 1 in the evening. That work together to address 3 separate mechanisms driving constipation in the aging gut. I will explain the biology behind each one, because understanding why something works is the only way to know if it is actually working. And I will give you 2 simple movement techniques you can do from a chair that physically help move things along from the inside. We'll close with a concrete 3-step plan you can start tonight. Stay with me, because what I am going to show you in the second half of this video about gut inflammation is something most people have never connected to constipation before. And once you understand it, a lot of other things will start to make. Before we talk about what to add, I need to show you what is actually happening inside your gut right now. Because without this, the 3 additions I am about to give you will seem like folk remedies. With it, they will make complete physiological sense. In clinical gastroenterology, we call this reduction in peristaltic efficiency, one of the most predictable and underaddressed consequences of aging. It is not your imagination. The conveyor belt has genuinely slowed down. It naturally produces less bile as you age, and bile is not just a digestive enzyme. It is your intestinal lubricant. It keeps stool soft, slippery, and mobile. When bile decreases, stool dries out, hardens, and the colon has to work much harder to push it through. This is why many people over 60 notice that constipation seems to get worse over time, not better, even when their diet has not changed. Third, and this is the one most people have never heard explained, low-grade chronic inflammation develops in the intestinal lining itself. Waste that sits in the colon too long creates pressure and irritation. That irritation triggers an inflammatory response in the mucosal lining. And when the intestinal wall becomes inflamed and swollen, the passageway narrows physically. Even well-hydrated stool struggles to move through an inflamed colon. This is what the science on this is clearer about than most people realize. These 3 mechanisms are why plain water, even a lot of it, does not fix the problem. You need something that wakes up gut motility, something that supports bile production and stool consistency, and something that addresses the inflammation, narrowing the passageway from the inside. That is exactly what these 3 additions do. The first addition is warm water. First thing in the morning before anything else. And I know what you are thinking. Warm water? That is it? Let me show you why this is the right mechanism at the right time. After a full night in a resting state, your colon is cool, your intestinal muscles are tight and sluggish, and whatever stool has been sitting there overnight has had hours to lose moisture and harden against the intestinal wall. Your gut needs a thermal signal to shift out of that resting state and into active motility mode. Cold water does not send that signal. In fact, the sudden temperature change can cause your intestinal smooth muscles to contract further rather than relax and open. This is a reflex response, and it works directly against what you need in the morning. Warm water does the opposite. When it contacts the stomach lining and passes into the small intestine, it relaxes the tight muscle fibers along the colon wall. It begins to rehydrate the dried surface layer of stool that has been sitting there overnight, and it triggers what is known as the gastrocolic reflex, your body's built-in signal that food or fluid has entered the system and waste should begin moving downward. A 2019 meta-analysis published in Complementary Therapies in Medicine, which analyzed data from randomized controlled trials in adults, interventions targeting gut motility, including thermal stimulation, were significantly more effective than control conditions in this population. That is not a minor finding for something that costs you nothing and has 0 side effects. Here's exactly what to do. Before your coffee, before breakfast, heat about 12 ounces of water to a comfortable warm temperature, not boiling. Think of a warm bath, not a hot one. Sip it slowly over 10 to 15 minutes. Do not rush it. The slow, steady intake allows the warm water to coat the full length of your digestive tract as it moves down, rather than passing through in one rapid rush. In my practice, I consistently see this single change make a noticeable difference within 3 to 4 days for patients who have never tried it. And the reason is straightforward. You are working with the biology of an aging gut, not against it. Now, warm water wakes up gut motility, but if your stool has already dried out and compacted over days or weeks, you need something that pulls moisture back into it from the inside. That is where the second addition comes in, and it works through a completely different mechanism. The second addition is fresh lemon juice in water, taken around midday, about 20 minutes before your main meal. And here is the biology that most people completely miss. The benefit of lemon juice is not primarily the water content. It is the citric acid and the natural compounds in fresh lemon that act directly on your liver. What we know is that the citric acid in fresh lemon juice stimulates bile production and release. Your liver responds to these compounds by increasing the flow of bile into your digestive tract. And as I explained it earlier, bile is your intestinal lubricant. When bile output is low, stool becomes dry, dense, and difficult to move. When bile flow improves, the entire downstream process becomes more efficient. There is also a secondary mechanism that I find clinically underappreciated. Citric acid draws moisture osmotically into your bowel. It softens compacted stool from the inside out, but by actively pulling fluid into the intestinal space where stool is sitting. A 2021 systematic review published in PubMed examining the clinical use of natural plant compounds for gastrointestinal diseases found consistent positive effects on bowel motility and stool consistency from citrus adjuncts to standard hydration, which is exactly how we are using lemon water here, not as a standalone intervention, but as a targeted bile-stimulating tool layered on top of your morning warm water. Here is the routine. Take a glass of room temperature water, not cold. Squeeze the juice of half a fresh lemon directly into the... Use a real lemon, not bottled concentrate. The concentrated version has lost most of the active compounds through processing. Drink it slowly over 5 to 10 minutes, about 20 minutes before lunch. I know what some of you are thinking right now. I tried lemon water once and it upset my stomach. Here is what that usually means. You used cold water, which compounds the problem, or you drank it on an empty stomach early in the morning alongside coffee, which can irritate an already sensitive gut. Room temperature, midday before a meal. That sequence matters. We have addressed gut motility in the morning and bile-related stool consistency at the midday. But here is what I want you to stay for, because the third edition addresses the mechanism that is most often responsible when nothing else seems to work. Coming up, I am going to show you what is actually happening inside your intestinal lining when constipation becomes chronic, and why a specific 3-ingredient evening blend targets that mechanism directly. Research published in peer-reviewed gastroenterology journals has documented exactly how this works at the mucosal level. That is in the next section. But before we get there, I need to close the loop on something. A lot of people ask me, Dr. Cruz, if I am doing everything right with diet and water. Why am I still having this problem? And the honest answer is almost always inflammation. The third edition is an evening herbal water using 3 ingredients that have well-documented effects on gut inflammation and intestinal motility: ginger, turmeric, and cloves. Let me walk you through the mechanism of each one, because this is not folk medicine. This is gastroenterology working with plant-derived bioactive compounds that have real clinical backing. Ginger acts as what researchers call a prokinetic agent. Its bioactive compounds, primarily gingerols and shogols, interact directly with the enteric nervous system, the network of neurons embedded on your gut wall. A 20 Science and Nutrition, which analyzed the clinical trial evidence on ginger and gastrointestinal disorders, found consistent evidence that ginger stimulates gastric motility. In plain language, ginger tells your gut muscles to start contracting again. It is an engine signal for a digestive system that has gone quiet. Turmeric, specifically its active compound curcumin, addresses the inflammation in your intestinal lining directly. A 2021 systematic review published in PubMed consistent evidence of curcumin's anti-inflammatory effects on the gut lining. What curcumin does at the mucosal level is reduce the swelling in the intestinal wall itself. When that swelling decreases, the passageway opens back up. Stool that was physically unable to move through a narrowed, inflamed colon can now pass through normally. That is the real mechanism at play. Cloves provide 2 additional effects. They act as a natural antispasmodic, reducing the cramping and sharp gas pain that often accompany constipation, and they have mild antimicrobial properties that help balance the microbial environment in the lower gut, which becomes disrupted when waste sits there too long. I want to pause here. Actually work. Why has no doctor ever mentioned them to me? And the honest answer is time. A standard appointment gives your physician 12 minutes. Explaining the mechanisms of bile reduction in the aging colon, the role of mucosal inflammation in chronic constipation, and which practical interventions have clinical backing for adults over 60 does not fit in 12 minutes. That is not a failure of your doctor. It is a structural limitation of the system. What I do here is give you the time that appointment never could. Here is how to prepare it. About an hour after dinner, bring 2 cups of water to a gentle simmer. Add a thumb-sized piece of fresh ginger, sliced thin. Add half a teaspoon of turmeric powder. Add 4 or 5 whole cloves. Let it simmer for 10 minutes, then steep for 5 more off the heat. Strain it into a mug and sip it slowly as you wind down for the evening. As this blend moves through your system overnight, the ginger is stimulating peristaltic contractions, the curcumin is reducing mucosal inflammation, the cloves are easing any cramping or microbial imbalance. You go to sleep with a gut that is actively being prepared for a better morning. Let me walk you through an illustrative scenario. A patient I will call Margaret, 67, retired nurse, had been dealing with constipation for over 2 years. She was on a high-fiber diet, drinking plenty of water, walking daily. Nothing worked reliably. I reviewed what she was actually drinking and when, the problem became clear immediately. Cold water first thing in the morning. No bile stimulation at any point in the day. No attention to the mucosal inflammation that had built up from years of inconsistent transit. We layered in these 3 additions over the course of By day 4, she had her first genuinely effortless morning movement in months. By week 2, she was consistent every morning. What changed was not the volume of water. It was the mechanism behind the water. Even with the most well-prepared stool in the world, your gut still needs mechanical assistance to move things through. 2 specific techniques help with this, and you can do both from a chair. The first is a seated abdominal massage following the path of your large intestine. Your colon travels up the right side of your abdomen, across the top, and down the left side. Gentle, firm circular pressure applied along this path in the direction of transit, clockwise from your lower right, up across and down on the left, physically nudges stagnant stool forward. A 2019 randomized controlled trial published in the Complementary Therapies in Medicine, which specifically studied adults over 60 with constipation, found that abdominal massage was significantly effective in improving constipation symptoms and quality of life. The 2025 meta-analysis in Frontiers in Medicine, which reviewed 41 RCTs involving 3,005 patients aged 60 and over, the strongest evidence base among all non-pharmacological options for this age group. That is not a minor finding. Do this for 3 to 5 minutes, ideally about 20 minutes after your midday lemon water when bile is flowing and the intestinal environment is most prepared. Now here is the part that surprises almost everyone. The second technique does not involve your hands. It does not involve movement of any kind. You simply lie still and breathe. And it may be the most powerful of everything I have shown you today because of what it does to your nervous system. Most people breathe into their chest, shallow and fast. When you breathe slowly and deeply into your belly, your diaphragm, the large dome-shaped muscle just below your lungs, descends with each breath and presses downward on your intestines. Every breath becomes a gentle, rhythmic internal massage of your entire digestive tract. But the deeper mechanism is what makes this particularly relevant for constipation. A 2022 randomized controlled trial published in Frontiers in Neuroscience, which enrolled 85 patients with constipation-predominant gut disorders, found that 6 weeks of bowel movement frequency, stool consistency, and rectal sensitivity. The mechanism was enhanced vagal activity. Your vagus nerve is the master control nerve of your digestive system. When it is activated through slow, deep breathing, it sends direct signals to your colon to begin its natural contracting cycle. 5 to 10 minutes of slow belly breathing in the evening after your herbal blend, lying comfortably on your bed or reclined in a chair. That is all it takes. Let your belly rise on the inhale and fall on the exhale. Slow and deliberate. You will fall asleep with your vagus nerve actively working on your behalf. Here is how I would approach this if I were starting tonight. Step 1, tomorrow morning, before your coffee, heat 12 ounces of water to a warm, comfortable temperature and sip it slowly over 15 minutes. This is your non-negotiable morning foundation. Step 2, at midday, 20 minutes before your main meal, squeeze half a fresh lemon into a glass of room temperature water and drink it slowly over 5 to 10 minutes. Give your liver the bile signal it needs. Step 3, 1 hour after dinner, prepare your ginger and turmeric blend. Simmer for 10 minutes, steep for 5, strain, and sip it slowly as you wind down. Follow it with 5 minutes of add the abdominal massage to your routine at midday after the lemon water. 3 to 5 minutes, clockwise, gentle but firm pressure along the path of your colon. The evidence behind each of these is real and consistent. None of it requires a prescription, a supplement, or anything expensive. What it requires is understanding the mechanisms your gut actually needs at this stage of life and responding to them with the right inputs at the right times. Your gut controls more than digestion. What I see in my practice consistently is that once transit normalizes, other things improve too. Sleep quality, energy, that people have just accepted as normal. And the science on this connection between gut function and systemic health is clearer than most people realize. If this gave you something useful today, subscribe to the channel. What I want you to see next is the video on how your gut microbiome changes after 60 and which specific changes have been directly linked to the kind of chronic slow transit we talked about today. That video will complete the picture in a way that I think will surprise you. Take care of your gut. Every organ in your body is downstream of it. And if you know someone over 60 who has been dealing with this problem quietly, send them this video. The mechanism is the same for everyone, and knowing it changes what you do next.